Hi, my name is Dr. Amy Hare, and I'm a neonatologist and researcher at Texas Children's Hospital, Baylor College of Medicine. I'm here today to talk about feeding intolerance in preterm infants. Feeding intolerance is when babies do not simply tolerate their feeds, meaning they may have spit ups or emesis, they may have abdominal distension. They may, prior to their next feed, if they're tube fed, have residual food in their stomach, and that's called a residual. So all these signs are early signals to us that something may further be going on with the baby. So in preterm infants in particular, the possible consequences of feeding intolerance are that could be a sign of infection, early infection. It could be a sign of an intestinal disease called necrotizing enterocolitis. It also could just be a sign that the infant needs to more slowly advance to full feeds and may not be able to be fed as quickly. So it's very important once we determine an infant has feeding intolerance that we examine the infant, especially the abdomen, and try to figure out what is the root cause of this feeding intolerance. We'll obtain an X-ray sometimes to look at the intestinal bowel gas pattern, and that would tell us if there was necrotizing enterocolitis or not. And sometimes we may simply skip a feed or skip 2 feeds and restart them, hoping that giving smaller amounts to the infant will improve this feeding intolerance. Some of the counter strategies for feeding intolerance are to have a standardized protocol in the NICU to slowly advance feedings. This way, consistently, the baby will see a small incremental increase in feeds each day as they're advancing in the first week of life to full feeds. In addition, we know that mother's milk is better tolerated than formula. And so trying to optimize the use of mother's own milk and try to give a bigger dose of mother's milk to babies will help with feeding intolerance. If an infant's receiving pasteurized donor human milk as a supplement to mother's own milk, sometimes there's a slight chance of feeding intolerance with donor milk, but definitely not as much as formula. And other strategies with feeding intolerance are to really just, it may be an early signal that something else is going on with the infant. So it's very important that we carefully follow these clues and investigate and make sure that we are treating the right problem. My advice to parents whose baby may have had an episode of feeding intolerance is to continue to advocate for your baby, meaning often parents are at the baby's bedside the most and know subtle signs and cues that their infant's giving to them. I would tell parents not to worry after one episode of feeding intolerance, that it is quite common in preterm infants. And sometimes will definitely go away over time. And so I'd say not to worry too much about the first episode of feeding intolerance, but if they continue or you notice a change in how your baby's acting, it's very important to let the nurse and the doctor know so that they can further investigate your baby. And I would encourage moms to continue to pumping mother's own milk, is that we know that that is a medicine, has immune protective factors, not just nutrition for preterm infants.